So how's the pathophysiology portion going?
Community Regional Medical Center's Dr. Phil Mintler and Dr. Michelle Chang are pharmacists, but you won't find them behind a counter like some of their colleagues.
We're essentially just another layer of safety amongst the patient safety system. We're immediately involved in the patient's care right when they enter through the ER doors, and we'll typically stay and follow with them through their care.
Dr. Phil and Dr. Chang are among a handful of emergency medicine pharmacists in the state.
Yes, one of a few in the whole state. There's not very many of us out there in California, and I think it's going to grow.
With nearly 90,000 patients treated a year in Community Regional's emergency department, it is considered one of the busiest EDs in California.
A lot of hospitals are kind of looking at us, a lot of pharmacies are looking at us saying, wow, this is the ideal place to have a pharmacist right in the emergency department. Here's where we would have the norepinephrine. Other places that might have emergency medicine pharmacists in California, UCLA for instance, Cedars-Sinai.
And other top hospitals around the United States.
Johns Hopkins, University of Illinois, Rutgers University, Robert Wood Johnson University Hospital, Detroit Receiving. These are major emergency departments, and they all have definitely innovative practices, putting out a lot of research, and those are the places that have emergency medicine pharmacists.
Community Medical Center's Chief Quality Officer, Dr. Thomas Utek, says their work is special.
As a clinical pharmacist with emergency training and specialty, we are in a unique situation. We are the only emergency department in the Central Valley with this level of care.
ED pharmacists like Dr. Mintler and Dr. Chang are just another way community continues to bring high-quality care to its patients.
You always want to check also.
It truly is a different level of care to have that pharmacist person at the bedside working with the physicians and nursing staff and at times the patient to optimize their drug therapy, whether they're going to be admitted to the hospital or go home.
And having a pharmacist on the floor is beneficial for everyone.
It's helpful for the nurses specifically because it allows them to focus on the patient and take care of the things that they need to do. They don't have to worry about getting this particular medication ready or trying to find the medication, run to the room where it is. I can take care of that in a trauma situation.
We have lots of evidence that's available to us online, etc. But unfortunately in the busy arena of an emergency department, when somebody's sick and or close to dying, we don't have time to necessarily look up the latest medicine or the best dose to give for the specific condition.
And for the physicians, it also helps them in more severe circumstances where, certain drugs need to be drawn up, and I can anticipate what medications they're probably going to want, what doses they're going to want, and I draw it up to have it ready for them. That's one less thing that they have to worry about as well.
It all works because this helps save precious time, saves lives, and promotes teamwork.
Everybody's got a role, everybody's got a job to do, and it just allows the physicians and nurses to focus more on the patient and what they need to do and less worry about the medications and whatnot, and let me handle that for them.
Dr. Mintler's reasoning is safe and simple.
Right when the patient comes in to our hospital, let's start solving the problems with medications right there. Being the only level 1 trauma center as well, it's very important to have a clinical pharmacist in the emergency department because we see a much higher level of acuity type patients. It just relieves the stress and workload on all the other personnel in the emergency department, nurses and physicians. At the moment, kind of a rarity, but we're definitely picking up steam. A lot of hospitals are kind of looking at us.
Dr. Utek says while there are only 2 emergency medicine pharmacists, community continues to look into the future with other highly trained clinical pharmacists.
We have several in our institution, in the ICU, in infectious disease, and again, all of those are cutting edge types of folks.
And it's continuing to grow with the pharmacy residency program. Dr. Chang was a resident pharmacist at Community through its pharmacy program before joining the emergency department. Currently, other pharmacy students are training in the same program.
We also have residents who come in here through our ER on rotations, and we help mentor them through the process as well.
Community Medical Center's pharmacy residency program has brought top-notch candidates to the Central Valley. The residents serve as co-preceptors with faculty members for University of California, San Francisco, Fresno, and University of the Pacific.
We have UCSF pharmacy students and UOP pharmacy students, and they typically vary in numbers throughout the year.
Dr. Mintler says having an emergency medicine pharmacist ready for patients is part of Community's leading-edge treatment.
Absolutely innovative for community medical centers absolutely innovative for the Valley as a whole to have an emergency medicine pharmacist, or any clinical pharmacist for that matter.
Dr. Chang agrees.
Exhilarating and exciting. It's absolutely a great feeling. And I think that's what makes the job so great, and where I feel so motivated to wake up in the mornings to come to work.